Hi all, today we will learn about pulmonary hypertension. What is pulmonary hypertension? Pulmonary hypertension is hypertension or increased blood pressure in pulmonary circulation. So the pulmonary circulation starts from right side of the heart from the right ventricle. The right side of the heart receives deoxygenated blood and this blood reaches right atrium. From right atrium it flows into right ventricle, and from right ventricle it is pumped into pulmonary circulation. So the left pulmonary artery carries deoxygenated blood to the left lung and the right pulmonary artery carries deoxygenated blood to the right lung. So pulmonary hypertension is defined by increased blood pressure in pulmonary circulation, and if mean pulmonary artery pressure, just like systolic, diastolic and mean blood pressure, mean pulmonary artery pressure greater than 25 mm Hg at rest or greater than 30 at exertion, it is called as pulmonary hypertension. So what happens in pulmonary hypertension? The blood pressure in the pulmonary artery increases. As a result, there is a backup pressure to the heart, to the right side of the heart. As a result, right ventricle enlarged, right ventricular strain that leads to right-sided heart failure. Now, pulmonary hypertension is divided into 5 groups depending upon the causes of pulmonary hypertension. Group 1 is pulmonary arterial hypertension. In pulmonary arterial hypertension, the pulmonary arteries becomes narrowed, stiff and swollen. As a result, the blood pressure in the pulmonary artery goes up. And the causes are idiopathic, no specific cause. It can be hereditary or seen in families due to certain toxins or use of illegal drugs, example amphetamines and cocaine. Pulmonary hypertension seen in newborns. It can be due to congenital heart disease, or HIV also can lead to pulmonary arterial hypertension. Now, group 2 pulmonary hypertension is due to left side heart disease. That means left-sided heart failure, systolic, diastolic dysfunction, or due to valvular heart disease. Group 3 pulmonary hypertension is due to lung disease, example COPD, interstitial lung disease, or due to hypoxia that is seen with sleep apnea or chronic exposure to high altitude. So when there is a chronic exposure to high altitude, the inhaled air has less oxygen. As a result, there is vasoconstriction of the pulmonary arteries. As a result, the blood pressure goes up. Now the group 4 is chronic thromboembolic pulmonary hypertension. This is because of the presence of blood clots. So if there is blood clot in the pulmonary arteries, it obstructs the flow through the arteries. As a result, the blood pressure goes up. Now group 5 is related to multifactorial. That can be any other systemic disorders. Example, it can be due to hematological disorder, systemic disorder, metabolic disorders or others. So the classification according to the causes is very important because the treatment may vary with the cause. Now let's see the signs and symptoms of pulmonary hypertension. The signs and symptoms are not specific. The early symptoms, patient may experience dyspnea, shortness of breath with activity, and as the disease progresses, they may feel syncope or dizziness, chest pain or chest pressure, and if it advances to right side heart failure, they may have complaints of leg edema and congestive liver failure. Now, what are the complications of pulmonary hypertension? The complications include the right-sided heart failure. So, if the blood pressure in the pulmonary artery goes up, there's a backup pressure to the right side of the heart leading to right-side heart failure. As a result, irregular heartbeats. Patient may cough out blood. This is because the pressure goes up. As a result, RBC leaks into the alveoli and cough out blood. Thrombosis, the pulmonary hypertension increases the risk of clot formation. And finally, congestive liver disease. Now let's see the diagnostic test done in pulmonary hypertension. So in pulmonary hypertension, the EKG done shows right bundle branch block or right axis deviation. This is because of the right ventricular strain or hypertrophy. X-ray shows enlarged or congested pulmonary arteries. Echocardiogram. In echocardiogram, it gives an estimated value of pulmonary artery systolic pressure and measures right side or right atrium and right ventricular size. Right side catheterization. In right side catheterization, cardiologists insert a catheter into the right side of the heart into pulmonary artery. This gives an accurate value of the pulmonary artery pressure and can diagnose pulmonary hypertension. Other tests include VQ scan, CT, angio. This helps to diagnose blood clot, sleep study to diagnose sleep apnea, and pulmonary function test to rule out any lung disorders. Along with this, blood tests are done to find genetic cause or liver or kidney disorders. Now let's see the management of pulmonary hypertension or the treatment of pulmonary hypertension. The treatment depends upon the causes of pulmonary hypertension, and the medication for pulmonary hypertension are mainly beneficial for group 1. It's because other group has a significant cause and this cause needs to be treated. So the general management include oxygen. If the patient is hypoxic, administer oxygen. Anticoagulants, because pulmonary arterial or pulmonary hypertension increases the risk of blood clot formation. So blood thinners. Diuretics. So this helps to remove excess fluid. As a result, blood pressure drops. If there is evidence of right side heart failure, digoxin. And other medicine which are specific to pulmonary hypertension, it depends upon this causes or stage or group of pulmonary hypertension. So along with general management, patient has to undergo an acute vasoreactivity test. In this test, patient is inhaled nitric oxide. This is a vasodilator. And if the pulmonary artery dilates and the pressure drops by greater than 10, those patients are positive. That means they can be treated with oral calcium channel blockers. These are vasodilators. So if this is beneficial, treat them with oral calcium channel blockers. It helps to dilate the pulmonary arteries and decreases the blood pressure. Example of calcium channel blockers include amlodipine, diltiazem, and nifedipine. So if that is effective, continue the treatment. If not, or if the acute vasoreactivity test is negative, the person or patient may need advanced medicine. Now let's see the medication that are used or advanced medicine in pulmonary hypertension. First include prostacyclin agonist. So these are vasodilators. This dilates the pulmonary arteries. As a result, blood pressure drops. Example, ipoprostenol, treprostinil, and iloprost. Ipoprostenol can be given IV for higher risk group. Treprostinil, iloprostenil can be available in inhalation, nebulization, or by PO, and PO medication is recommended for lower risk group. The second group of medicine include GSC stimulators, that is guanylate cyclase stimulator. So the action is it increases the nitric oxide in the body and it relaxes the pulmonary arteries. As a result, the blood pressure drops. The third group include phosphodiesterase 5 inhibitors. Example, sildenafil and tadalafil. These two medicines can be given by mouth and given in lower risk group. So it increases the nitric oxide, it relaxes the pulmonary arteries, and it drops the blood pressure. The fourth advanced medicine include endothelial receptor antagonist. So it reverses the effect of endothelial. It has a vasoconstrictory effect. It reverses the effect. As a result, vasodilation happens and the pulmonary artery pressure drops. Example, bosentan, macitentan, and ambrisentan. So along with this medication, some of the patient need a combination therapy. That means more than one medicine is needed to treat pulmonary artery hypertension. But if medical management fails, they may need surgical management, include atrial septostomy and lung transplant. In atrial septostomy, there is a hole is created. It's a open heart surgery, and a hole is created between the atria. It relieves the pressure in the right side of the heart. And lung transplant is indicated in young patients and who are having idiopathic pulmonary artery hypertension. So it's the management of pulmonary artery hypertension. So today we learned about pulmonary hypertension, and thanks for watching my video.